The World Health Organization hopes hundreds of millions of doses of coronavirus vaccine will be produced this year, should any currently in clinical trials prove to be effective. Chief Scientist Soumya Swaminathan went on to say Thursday that the plan was to make 2 billion doses available by the end of 2021. She said the WHO is drawing up plans to help decide who should get the first doses once a vaccine is approved.
Should it go only to the countries which have paid for it or are capable of paying for it to cover their own populations, or should it go to protect frontline health workers or the most vulnerable people, whether they are the elderly or whether they are people with other diseases?
Around 10 potential vaccines are now undergoing human trials, with the aim of infection-preventing doses becoming available in the coming months.
We go through phase 1, 2 and 3. 3 of those are entering phase 3 very soon in the next couple of weeks.
Countries have already begun making deals with pharmaceutical companies to order doses even before any vaccines have been proven to work. Swaminathan described the ambition for hundreds of millions of doses this year as optimistic, and the hope for up to 2 billion doses of up to 3 different vaccines next year as a big if. She added genetic analysis data collected so far showed the coronavirus has not yet mutated in any ways that would alter the severity of the illness.
Dexamethasone, a cheap steroid that can help save the lives of patients with severe COVID-19, should be reserved for serious cases, the World Health Organization said on Wednesday. Trial results announced on Tuesday by researchers in the UK showed the drug cut death rates by around a third among the most severely ill coronavirus patients admitted to hospital. It has been used since the 1960s to reduce inflammation in diseases such as arthritis. That makes it the first drug proved to save lives in fighting the new coronavirus disease. Countries are now rushing to ensure that they have enough of it on hand, although medical officials say there is no shortage of the medication.
In Oxford University's
The UK's Health Minister Matt Hancock says Britain has increased the amount of dexamethasone it has in stock and on order to 240,000 doses. But the head of the WHO's emergency program, Mike Ryan, said the drug should only be used in those serious cases where it has been shown to help. Preliminary findings shared with the WHO showed that for patients on ventilators, the treatment was shown to reduce mortality by about a third, and for patients requiring only oxygen, deaths were cut by about 1/5.